So this is third part of obstructive sleep apnea video. So in this part, we are mainly going to deal with non-surgical management of obstructive sleep apnea. Most of these patients, they are obese. So the mainstay of non-surgical treatment is going to be weight reduction. For this, you have to change your lifestyle and diet modification, of course, and regular exercises will help you. That will be in the morning and night, and minimum of 20 minutes of brisk walk, and you have to sweat a lot when you have the brisk walk. You have to do like that. And your yoga exercise also will add up to this. So it is best for the diet modification that you meet the dietitian and tell them that this is what you like to have usually in the morning, afternoon, night, and give them a list of what you are eating, and they will prepare a list for you and how much quantity you are supposed to take. That's the best we can do. So I'll tell you small tips how to help you at home. So the bed, when you sleep, the head end of the bed, it has to be elevated at least 30 degrees. That will help you a bit. Along with that, the sleep position, most of these patients, they suffer, especially the gasping and the choking sensation when they lie down straight. So try to avoid that position. Try to lie down on the sleep on the left side, or either on the left or to the right. I mean, in short, you have to avoid the straight supine position. So how can we do this? So I will tell you 2-3 things so that you can avoid that position. One is you get wedge pillows. So when you're sleeping on the one particular side, when you turn to one particular side, you can keep the wedge pillow behind so that it will prevent you from lying down straight. That is one. Second simple technique is you can tie up a tennis ball to your back. So whenever you turn, you try to sleep straight, it will not allow you to sleep straight. You tend to go back to that previous position. That is 2. So instead of a tennis ball, you'll get something called shark fin. That also has to be tied in the back. So whenever you try to sleep straight, that will poke you, that will make you uncomfortable. So you tend to sleep on the lateral sides. So you get latest gadgets like you have something called neck worn vibrating device. So when you are in the lateral position, it will not make any alarm, but as soon as you become straight, it will make a vibrating sensation. So that time you tend to become disturbed and you go back to the previous position. And there is one more gadget that is called positional alarm, that you can keep it on the center and the behind. So whenever you touch that, you tend to touch that, it will make an alarm. So these are the ways which will prevent you from lying down straight. So if you can lie on lateral side, that will be better for you. Now let me give you tell you something about some gadgets, other devices like there is something called mandibular advancing device. So this is mainly, all these 3 devices mainly it's given by, you have to meet the orthodontist for that. So the first one, what it does is, when you meet the orthodontist, he will first see how much of protrusion of this jawbone is possible for you, like this. So he will measure that. After that, he will give you an appliance something like this, which has to be worn during the night. And what it does is, it will push the lower jaw anteriorly so that you get more space posteriorly behind the tongue. So when you get more space behind the tongue, you will be able to breathe normally. That is one. Second is tongue retaining device. So this is the device, and when you are about to go to sleep, you have to see the tongue will be protruded and it will be inside this. It will pull the tongue out. And this device is kept in position because this is flange. So same mechanism, it provides enough air, enough space behind the throat. That is second. Third one is, when some patients, the main problem instead of being tongue, maybe it is a palate. So it will vibrate a lot, it is redundant. In these type of patients, what we can do is, we will provide you with palate lifting device, and it will prevent the flapping and the mass movement also. So these are the 3 devices which are commonly available, which can make you little comfortable. I want to tell you something about some exercises. The tongue strengthening exercises, and the oropharynx, we have so many muscles, strengthening exercises for that too. We have so many exercises. Out of that, let me tell you 2 or 3. One is, you have to protrude your tongue completely outside, like this, and keep it in that position for 10 to 15 seconds. Then you relax. So you keep on repeating this at least 10 or 15 times. So you have to do in the morning and night. That is one exercise. Second exercise, with the tip of the tongue, touch the hard palate and slowly drag down, touch the whole hard palate and take it behind, like this. So this you have to repeat 10 to 15 times at a time. That will be in the morning and night. That is second. Third one is, protrude the tongue completely and slightly bite your tongue. Then look down, then keep it like that and look down, straight, look up. And when you look up, in the same position, try to swallow. So mind, your tongue is still outside and with a little pressure. Then you swallow. So what happens is, tongue doesn't move, the muscles behind the tongue, the oropharynx, that moves. So these are the simple exercises which can strengthen your tongue as well as the oropharyngeal muscles. Likewise, simple blowing the balloon also can help you. That again is 10 to 15 times in the morning and night. That also will help you. So exercises we have seen, and tongue retaining device, mandibular advancing device and palatal lifting device we have seen. Now coming to, so before that, see the devices which have, the three devices which I have mentioned so far, it has got some, so when you use it for long thing, you can get two problems. One is, since the mandible is pushed anteriorly and even the tongue which has been pulled out by the device, what happens is you have two joints here, which are, these are the temporomandibular joints. So when you use this device for a long-term base, you get temporomandibular dysfunction, doesn't work properly. Likewise, you may get teeth movement problems also. And you cannot use this device in children, and those who are already they have temporomandibular joint dysfunction, those people those patients cannot be using this, because temporomandibular dysfunction may increase. Now the next part. So we have seen exercises, the weight reduction, lifestyle modification. Then coming to the exercises we have finished. Then the devices. Now we have to talk about the PAP machine, that is positive airway pressure machine. So what it does is, see, this is the machine and you have a connecting tube and you have a mask. So this machine is set in a particular particular pressure, and it delivers a pressure. That pressure, what it does is, it dilates the upper airway. Whichever part is collapsed, it keeps it patent. That is the function of this device. So if it does this function by doing a continuous positive pressure, then it's called as continuous positive airway pressure machine. That is a CPAP machine. That's how it works. Now, see, this is a machine. This is how it looks like. What I have shown is old generation machine. This is a CPAP machine. This is a BiPAP machine. I'll tell you what is the difference between these two. And what are the indications for this machine? So this machine can be used in those patients who have been diagnosed as moderate or severe sleep apnea. So if you watch my first part video, part 1 of obstructive sleep apnea, you will know what is mild, what is moderate, or what is severe sleep apnea syndrome. So in moderate to severe sleep apnea syndrome, this machine will help. Likewise, if it is a mixed sleep apnea syndrome also, machine will help. The third indication is going to be those patients who have been diagnosed as sleep apnea and they have done a surgery, and still after surgery the patient has not improved much. So the next alternative is going to be, we are going to provide with a PAP machine. The last being, the other indication is going to be even cardiac failure patients, they used to use this. So now the types of machine. See, already I have mentioned that one type of machine, it provides a continuous pressure which is called as continuous positive airway pressure. So this, how much pressure should be set is been decided by when you do a sleep study. At the same time, we can keep a machine also and we can find out how much pressure is needed. It is called the titration of the machine. So that we can find out. So after knowing the value, we can set the machine at that particular level, and if it gives continuous pressure at that level, it's called as continuous positive airway pressure machine. Some patients, they don't need continuous pressure, they become uncomfortable because of that. So they need a particular pressure during inspiration, taking in a breath, and need a particular pressure when they expire, that is giving out the breath. So two different levels. So machine is set at that particular level, by level. It's two different levels. That's how it works. The third being, the machine decides how much pressure the patient needs. How it tries, as and when the patient uses the machine automatically adjusts to the pressure of how much the patient needs. So that is called as automated machine or auto PAP machine. And the latest being, the other machine being BiPAP, ST and ASV, that is mainly used for central sleep apneas. So these are the different types of sleep apnea. Now in India, the cost for the machine, it starts from 45 to 50,000 rupees, and the latest being, the most modern being 1 lakh to 1,25,000 rupees. See, we have so many different types of management depending upon the patient complaint, depending on the severity, depending upon the level. See, in all that, if you ask me which one gives a dramatic relief, the answer is going to the PAP machine. Suppose I get a patient now, today, and I have the report in front of me, and it is diagnosed as moderate to severe CPAP, or maybe it's, let me say it's severe BPAP, AHI, severe sleep apnea syndrome. And while driving he sleeps off, while in the meeting he sleeps off, in the morning itself when he sits for some time, if it happens like that, to cure him at the earliest, I'll give him a CPAP machine or the PAP machine. I'll give him a PAP machine. No, I'll give him a PAP machine. Now, so what will happen is, you will get dramatic relief within 2-3 days. Now, the diet modification and all the things which I have told you, all these will take time. Even if I subject him to surgery, for the surgery to heal also it will take time. But this BiPAP, the PAP machine will have good relief within 2-3 days time, provided the compliance of the patient is good. So when I say compliance of the machine, before that, so this is how the machine looks like, This is the machine which I am holding, this is a connecting tube, and this is a face mask. And the face mask, this is a machine. So this part is a machine and this part is a humidifier, so that the oral cavity doesn't become dry. Now your mask have 3 types. You have total mask, you have full mask, and the nasal mask. And the nasal thong, you have the latest one, that's what I have shown here. Now, when I said compliance of the machine, compliance means that you have to use the machine at least for 4 to 6 hours a day, per night, and that has to be continuously used for the whole week. That is what compliance means. So the new generation machines, it has got so many advancements, so the new generation machine, it has got auto adjustment that it can switch on between 110 volts to 220 volts, that is one. And it can be battery operated, that is, it works an inverter system mechanism, that is 2. And for central sleep apnea, we have something called adaptive servo ventilator, that is also a new advent. So this is all about the non-surgical management of sleep apnea. So please do watch the 4th part, that is the surgical management of obstructive sleep apnea. Thank you so much.